So anyway, so my name is Fasih, and I think I've met many of you before at some of these previous webinars. I'm a respiratory registrar by background. I'm currently undertaking some research. And so what we'll be doing today is I'll be talking for about 15 minutes, maybe less, maybe around about that time. Then I'll hand over to Saad, who will introduce himself, and he's actually a dentist. And then we'll open the floor up and take your questions, okay? So we have an hour in total. Might not need the whole hour, we might do, we'll find out. But it'd be great if you guys could get involved, ask any questions, and if we can't answer, that's great. We'll say, it's not great, but we'll say we don't know, we don't know, we can hopefully signpost you. So feel free, there's no such thing as a stupid question, and I'll remind you of that. So I hope you can see my slides. And if you can't, then can somebody unmute themselves and tell me, but I'm going to assume you can. Right, so. Okay, so what we're going to talk about is, we're going to talk about entry requirements into medicine. We're going to talk about the duration of study, some of the skills that you need to be a good doctor, and some of the career opportunities. And so that's what we're going to cover today, except we're not, okay? This is information that's available online, and you can get all of this stuff from prospectuses, from Google searches. I mean, this is stuff that you probably know already. And I thought about how we should tackle this, and I thought we should take a slightly different approach, okay? So instead of telling you stuff that you already know about medicine, I'm going to slightly challenge some of your intentions, okay, and make you think a little bit in the next 10-15 minutes, okay? So we're going to start with a bit of a story, okay? And hopefully the story might not make sense whilst I'm telling you the story, but hopefully as we talk over the next 10 minutes, hopefully things will come together a little bit. So I have a good friend, and we went to medical school together, really intelligent chap, and one of my closest friends. And he sailed through GCSEs, sailed through A levels, straight A student, did very, very well. Went to medical school and got through the first year. And then in second year, he just stopped going to lectures. He wasn't motivated. And at the end of the year, he failed. He resat the year. He was lucky. He was given the opportunity to resit the year. He scraped through the second year, scraped through the third year, failed again in the fourth year, passed the resit, got to finals, failed finals, was kicked out of medical school, spent about a year or 2 years out of medical school, appealed, managed to get back in, again, very, very unusual, very lucky, eventually qualified. So what a 5-year degree is took him about, I don't know, 8 or 9 years. So a lot longer than everybody else. Then became a junior doctor, and didn't really know what he wanted to do, did F1, F2, became a locum doctor, did that for 3 or 4 years, still not sure what he wants to do, and has recently commenced GP training, okay? And he is somebody who did medicine, but has never enjoyed medicine, okay? And as a consequence of that, has struggled throughout the last 15 years, whether it's medical school or as a doctor. And I spoke to him a couple of days ago, actually. I said, it's one of my very close friends. And he said, I don't enjoy being a doctor. I'm going to, hopefully, in the next few slides, it's going to make a bit of sense as to why I'm telling you this. So what we'll do is I start with a quote. I always start my slides with a quote. So Wayne Dyer was a psychologist, for those of you that don't know. And what Wayne said is, our intention creates our reality. And that's what I really want to do here. I want to look at intentions. Why do we want to study certain things? And hopefully through the process, it will help to provide some clarity in your mind as well. It might not, but that's the objective here. So the question that I ask you guys, and it'd be great, as I said, to have some interactivity, is what are your intentions? So what I've done is I brainstormed about 10, 15 different things that I thought people would think about when they're applying to medicine. And one of the things that, often comes up is, I want to make lots of money. So if you want to be a doctor and the driver to becoming a doctor is this, I want to make lots of money, then I would strongly advise you to think of other things. Okay, medicine, dentistry, whatever it is, they're tough. 5 years at university, multiple postgraduate exams. It's a life choice rather than just a career. Okay, and if your ambition, if you're, everybody wants to, have sufficient money, but if your primary objective, your primary goal in life is to make lots of money, then medicine is definitely not an option. Is dentistry an option? Possibly. I hate to admit it, but dentists get paid better than most medics do. So, what is your driver? So if you're even thinking about this, I'm not sure whether to be a doctor or a dentist, what you really need to try and get past is, what's causing the confusion? What are my drivers? What are my intentions for actually considering these two careers? And you really have to dig deep and you have to explore what it is that you're putting these two careers. Because when I applied for medicine, I never considered dentistry. It just wasn't an option for me. It was either medicine. If I don't get into medicine, it'll be something else, like maths or something else. It was never medicine, dentistry. And we often see this comparison. I'm not sure whether to be a doctor or a dentist. I find it a little bit strange because I don't think they're that similar. And I really don't understand why people are confused between the two. So, let's go back to this. What are your intentions? If it's to make a lot of money, then, really, is medicine the right career for you? Okay, let's talk about the next one. I want prestige and status. And again, if that's your driver and that's your intention, then you're probably going to struggle to differentiate between medicine and dentistry because both are associated with prestige and status. And so again, that's not really going to help you to differentiate. I don't want to work hard. So that is a contradiction to wanting to be a doctor or a dentist. The reality is that if you want to follow one of these two careers, then you will need to work hard. So if your intention is, I don't mind working hard now, but actually in 5 years, in 3 years, I don't want to work hard, I would very strongly ask you to reconsider your options. I just want to be called Dr. So-and-so. Okay, so again, if that's your ambition, then, again, that's not going to get you through medicine. That's not going to get you through dentistry. And, again, you'll have to really reflect on what it is. Why do you want to be called Dr. X? And, is that more important to you than everything else? Somebody's just texting one of my friends saying clearly he's chosen the wrong specialty. I didn't realize you were watching, but anyway, he's actually an orthopedic surgeon, so I don't know why he's interested in this. So anyway, I just want to be called Dr. So-and-so. And, if that's your ambition, then that's, as I was saying, that's not going to get you through a difficult career. That's not going to, when the times are tough, when it's stressful, when patients die on you, when something doesn't go your way, just being, the privilege of being called Dr. X isn't going to work for you. Okay. So again, that's probably the wrong intention. I want flexibility and choice with my hours. So this is a really important one now, because now we're going to go from more generic, just probably slightly more specific. I want to choose my hours flexibly. I want to not work unsocial hours. So this is a very important thing to think about because we all want a work-life balance. But like everything, the way you have to think is I can't have everything. In an ideal world, yes, I'd want something that's well paid, something that's respectful, somewhere I can make a difference, something I've got flexibility, somewhere I can have a work-life balance, somewhere I can do this, okay? The reality is that doesn't exist, okay? You can't have everything. And so the way you have to think about is how important is it for you to have choice over your hours? Because if that's the most important thing, then that doesn't close the doors to medicine, but it does limit your options, because ultimately you can't be a frontline, emergency doctor, for example, if you want, not to work unsocial hours. But there are other options available. You can be a general practitioner, you can be a pathologist, you can be a psychiatrist. There's a whole host of options. So that's one of the beauties of medicine. So a lot of people say, oh, I want to be a dentist because I don't want to work, evenings and weekends. And I challenge that. I say, but as a doctor, Many doctors don't work evenings and weekends. It depends what specialty you pursue. So for me, if that's your reason to pursue dentistry, it doesn't work for me. Okay, I think there is plenty of flexibility within medicine, but your specialty, your options are limited, and we have to recognize that. I want to make a difference. So the first question that comes to mind here, what is it? What does it mean to make a difference? So everybody will say, I make a difference. An accountant will say, I make a difference. A domestic cleaner will say, I make a difference. A doctor will say, I make a difference. And a dentist will say, I make a difference. And everybody will. And really, what it comes down to is, how do you define difference? What kind of a difference do you want to make? And a lot of people know that they want to do something good in their life and that they want to make a difference to humankind, to people, but they don't know in what specific way. And again, so let's look at some of the comparables here between medicine and dentistry. As a doctor, I get to make a difference on a broader level. I get to really make a difference to patients' lives, not just with one area, not just with their oral cavity. And I'm sure Saad is going to challenge me shortly, and it's great to hear both perspectives, but I can make a difference to the patient globally. This is why I love medicine. I want to make a difference to my patient, but I want to make a difference globally. And I don't want to just be a single organ person, that's the only thing I can look after. And I'm not trying to demean dentists here, that's not my intention. I'm just building the profile. I'm just, telling you why I think medicine is so wonderful. So again, I want to make a difference, but what kind of a difference? Do you want to make a difference on a micro level, on a macro level? What does it mean to you? What does making a difference mean? And these are the things that you need to start thinking about, because these are the kind of questions that we ask our interviews. And this is what we're really trying to understand, is that, does this person understand what a career in medicine entails? Do they have the correct intentions? I want to save lives. Now, when was the last time that you heard that somebody died from their tooth falling out, or from, requiring a filling? So yes, I'm sure dentists save lives indirectly, and they improve lives without doubt. Pain is obviously, a tooth pain, if you guys have had, is a horrible thing. But if your real thing is, I really want to save lives, there's two things I'm going to say to you. Number one, I don't think doctors save lives most of the time. Okay, we have to accept that. A lot, we improve life, we prolong life, but we don't always save lives. Yes, we do save lives, of course we do, but that's not the primary thing. So that's the first thing. The second thing is, if you do want to, saving lives or, prolonging lives is really important. It makes you feel that, gives you that sense of achievement. For me, it certainly does. Then medicine, for me, beats dentistry any day. Because, as I said, in medicine, you have that opportunity. But again, you have to recognize that within medicine, there are a number of specialties. And you can argue that certain specialties, they don't save lives. So for example, palliative care doctors, completely opposite. They deal with dying patients. They improve the terminal phases of life, but they don't save lives. That's not a problem, but that's the beauty and the variety that medicine brings. So is that your ambition? Is that really what drives you to medicine? I want to help people when they are at their most vulnerable. And this is, again, a huge thing for me. The way I look at medicine as a doctor, that when patients come to you with a problem, they put their trust in you. They're really struggling. They've got this pain, they've got, something else, something's not working, they've got this psychological stress associated with it, and they're really suffering. And they come to you, they put their trust in you. They are at their most vulnerable. Now, that requires a set of skills. If you're somebody who struggles to connect with people, you're somebody who struggles to demonstrate sympathy, empathy, then clearly that's not going to be your objective, because you don't want to see people at their most vulnerable. And it's okay to accept these things. It's okay to be honest with yourself and say, actually, you know what? I love science, but actually somebody coming and opening up to me and telling me their problems, or somebody dying, is something that I'm really going to struggle with. Is medicine the right profession for you? I'm not saying it's easy. I don't enjoy it, but you get a sense of fulfillment. I would argue in this case that dentists also help people when they're at their most vulnerable. I mean, coming back to tooth pain and other things, people go to dentists out of desperation. It's a different type of vulnerability, I would say. But again, so is this your intention? I want to focus on one specific area. So, the drive generally across the healthcare, not just in the UK, but across the globe, is more specialism. you know, the days of the generalist is passing very quickly, and we have more specialists. Okay, and within that you have subspecialists. And the way I look at it, and again, Saad, I'm sure will disagree or will have his own take on it, is that dentists are specialists in one area, which is the oral cavity. Okay, within that they have subspecialisms. Okay, but ultimately their specialism is here. Okay, as a doctor, you will do the same. You will, unless you become a general practitioner where you're a generalist, most, you know, doctors, or I wouldn't say most, but a significant proportion will become specialists. So I'm a chest specialist, okay, and I specialize in the lungs. So you might say, oh, how is that any different? You're a specialist in one organ. I'm a specialist in the oral cavity. What's the difference? The difference for me is I chose my specialism 10 years after entering medical school. So 5 years at medical school, 5 years of junior doctor training. So 10 years later, I decided this is what I'm interested in. Whereas the dentists make that decision before they go to dental school. They have committed to the oral cavity. Whereas I could have chosen the brain, the heart, the lungs, the kidneys, the bones, whatever really. I had that opportunity. So I got to focus on that specialist area of my choice, which was an informed choice, which is a choice I made after exposure over a number of years. Whereas dentists are also specialists, but they're specialists in that area. So if you're absolutely convinced that you find the oral cavity and everything to do with it really interesting, great. If you're not sure, do you really want to commit to it from so early in your career? I look at things from a more general perspective. So again, you know, as doctors, we look at the human body as a whole. And again, I think dentists do as well, because they're all manifestations of systemic disease. So you have disease in different parts and they present orally. But I think, you know, as a doctor, you definitely have a more generalist approach to the human body because you don't know what's going to come through your door. Dentists do that, but they get the oral manifestations of systemic disease, as I said. Okay, whereas we actually deal with systemic disease rather than just the oral manifestations of it. Okay, I think, you know, that's not as black and white as I made it to be, but I think, you know, medics definitely are involved on a broader scale. I enjoy, so I've got a few more, I probably need to speed up a little bit. I enjoy working in large multidisciplinary teams. So if you're somebody who enjoys teamwork, being around people, you know, bouncing ideas, you know, all of that kind of stuff, then being a hospital doctor is more suited to you, okay, rather than a dentist, where you're probably working in an office-based environment. But again, even with the dentistry, there are options. You know, you can go and work in a hospital, I don't think maxillofacial surgery we can use because they have to train as doctors anyway. So yes, you've got more opportunity to work with people as doctors. I want a variety of working environments and approaches. These are all my biases are now starting to come in, of variety of working environments and approaches. So what I love about my profession, what I love about my day job as a chest doctor is I do ward work, where I see inpatients who are acutely unwell. I do outpatient work where I see patients who have chronic disease. I do procedures where I do minor ops and, you know, drains and lots of other things. I do the general medical take where I get patients who come in with general medical problems. I do teaching. I do leadership and management related stuff. I do research. I do a little bit of everything. So for me, every week is different. I get a huge amount of variety. And that's really important to me because I get bored quite easily. If I was doing clinic day after day after day or ward work day after day after day, I'd be absolutely bored out of my brains. So are you somebody who likes a bit of variety, who likes a bit of change, or are you somebody who likes routine? You know, it has to be, you know, I like to do the same thing every single day. So I'm going to bring my little spiel to an end there. And I think hopefully what I've demonstrated over the last 10, 15 minutes is it's never as simple as medicine versus dentistry. You know, this is the pros and cons of medicine. This is the pros and cons of dentistry. You know, we can all list them. You can find them online. What you really need to do is have that inside conversation. Speak to yourself, reflect, just stop, pause, reflect. What are my drivers to pursuing medicine and dentistry? And hopefully some of the stuff that I've said has resonated with you and you can, you know, you can take that on and reflect on it further. So the most important thing in my opinion is enthusiasm. So I always quote this: nothing great was ever achieved without enthusiasm. And I think ultimately what you decide to do, whether it's medicine, whether it's dentistry, whether it's a non-science career, whatever it is, okay, you do it because you're enthusiastic about it. You can see yourself enjoying it, because if you can't, it's going to be a long 40 years for the rest of your life, or longer, and you really have to enjoy what you do. So I'm going to bring my slides to a close, and I'm going to hand over to Sal to introduce himself, and he's going to talk to you about dentistry, and then we're going to open up the floor and take any questions. Sal, over to you.
Thank you, Fussy, for that very generous introduction. Hello, everybody. Good evening. My name's Saad, and thank you to Medsuccess for having me this evening. I'll just share my screen so I can bring up my presentation. Give me 1 minute. Okay, right. So hopefully you can all see that. See that? Is that clear? Yeah.
Yeah.
It's on the screen. Great. Okay. So I'm here today to talk to you about my career, dentistry, and hopefully help you along on that journey of reflection that Fussy so eloquently talked about. Hopefully by the end of this evening's presentation, I'll convince you that dentistry isn't just about teeth, which is a quite common misconception. So I'm going to be talking to you today a little bit about myself and my journey, about dentistry, unfortunately about the entry requirements, which I noticed Fussy glossed over, and perhaps I will too, because as he quite correctly said, most of it is all available online. Some of the opportunities that are available within dentistry, and some of my reflections as to why, what I found within dentistry over the past 10 years of being a dentist. So this is my journey, which started at the tender age of 13 when I decided to become a dentist. It wasn't a single thing that really struck me like a bolt of lightning that made me want to choose this career. I'd say it was a combination of just speaking to people, or speaking to dentists specifically, who had a very good opinion of their career. And I won't lie, it was also the eclectic smell of the dentist whenever I present to my dentist my checkups or my treatments. It's that mix of latex and disinfectant, which is sort of quite unforgettable. Thumbs up anybody who can relate to that. I'm sure there are a few of you, even if you're not willing to admit. So I had that target at the age of 13, and that really helped me to to set my goals and to sort of work towards hard at my GCSEs, my A levels, to get the grades to start dentistry at the University of Birmingham in 2005. That was me, all fresh-faced, starting out my dentistry. 5 years later, not smiling quite so much, as you can see that picture, but I promise you that wasn't ominous, of what was to come, because actually what I found in the subsequent years of having become a dentist was, quite an enjoyable career. So I took up a partnership in practice in 2011 in my home city of Leicester, and I worked towards doing multiple further qualifications, a master's degree. And just this year, I've been appointed a lecturer at the University of Bristol, which is my former university where I completed my master's degree. And I put this timeline up, not to blow my own trumpet or anything like that, but purely just to give you an illustration of what what variety there is within dentistry in terms of what can be achieved. There are people who have done a lot more than me. There are people who have done much less than me, and that's absolutely that's for me one of the beauties of dentistry, is that it has something for everybody. So dentistry is all about knowing what's normal within the oral cavity and being able to diagnose and treat problems of the teeth and mouth, to prevent dental disease, and also to prevent oral health, which is a large part of what we do. That in a nutshell is dentistry. Entry requirements, again, like I mentioned earlier, I'll gloss over this because this does vary from university to university, but ultimately very good GCSE results, UK CAP, plus or minus the BMAT, depending which university you're applying to, and then A-level results at AAA or ABB, including chemistry and biology, are generally the entry requirements. Very competitive, as you can imagine, as with medicine, but I wouldn't let that put you off by any stretch, for the reasons I'm going to be mentioning shortly. There are varied opportunities within dentistry after having qualified. So the vast majority of dentists, I'd say about 80% of dentists, having qualified their 5-year BDS or BCHD degree, depending on which university you go to, tend to end up in general practice. So that's your bog standard dental surgery in the community. There are some options for specialist practices, which is, so the General Dental Council defines 12 or 15 specialties in dentistry. So you can apply, you can become a specialist in one of those areas by doing further training, and you can practice within primary care, practices within general practice as a specialist. There are also opportunities within what we call the community dental services, which are for the more vulnerable members of our society. So those with disabilities or those with anxiety disorders. So they treat patients such as those. There are options within hospital dental services. So as well as general hospitals, which tend to have a small dental department, there are also opportunities within dental hospitals, which most cities in the UK, most major cities have dental hospitals, which are charged with training both undergraduates and postgraduates, as well as receiving referrals from primary care, general practice to treat more complicated cases. There are opportunities there. And then for the more adventurous amongst us, there are opportunities within the armed forces. So the Royal Navy, the Air Force, and the Army. So they tend to be quite generous, the armed forces, in that they offer either bursaries or grants so that they can fund your dental school education, as well as postgraduate education. But there's always a caveat, and the caveat of the armed forces generally is that they lock you in for a number of years, and I think that depends on how many years they pay for your education. So that's one opportunity there. And then finally, for those who are not so clinically minded, there are opportunities within industry. So obviously, dentistry as a career there are many key stakeholders within dentistry in the form of corporations who want to sell their products to patients, to dentists, and so there are opportunities within industry to become sort of key opinion leaders, either trialing products or speaking, in favor of certain products for certain companies, etc. So that, in a nutshell, is various opportunities within dentistry itself. So why dentistry? Right. So first off, I'd say it might be a bit of a cliche, but it's an intimate job, but with great impact. And I bring you this case below of this lady, who's one of my patients, who came with a mouth completely shot to bits, and she'd been like this for many years. Confidence, down in her boots. She really embarrassed. She'd be covering her mouth with her hand most of the time. Not so much a problem in the era of the mask that we're in right now, but this is a common complaint we have for patients who have a similar background. And you can really see her facial profile, even though you can't see her eyes, you can see her facial profile is really sunken in as a result of basically lack of teeth and lack of any oral structure. And to take that patient, to understand her problems, to get a background of where she's coming from, to sort of do a thorough examination and identify what her problems are, and then discuss with her the treatment options and coming up with a solution for her. And being with her on that journey to achieve that end result, which we achieved over several months, you can see an instant makeover in terms of her appearance, her confidence. Even though you haven't spoken to that person, you haven't met that person, you can tell instantly from those two photos that it looks like a different person. And by doing that, by taking that patient on that journey, you've essentially gained a patient for life. And what I mean by that is that patient, not only is that patient going to come back to you for their checkups, or when because you've sort of made them less anxious, they're willing to come to the dentist more, and they're willing to take care of their oral health more, which is in of itself quite rewarding. They'll also recommend their friends, they'll recommend their family, and what you've got there is you've instantly surrounded yourself with a group of like-minded people, who get on with really well, who make your working life, your working day really enjoyable. And so you end up seeing, especially if you work in general practice, you end up seeing patients, multiple generations. You see the grandparents, you see the children, you see the grandchildren, which always is really satisfying and leads to the formation of these lifelong relationships. Another reason is dentistry is unique, I feel, within healthcare, in that it combines the skills of medicine, of engineering, and of art. So in a typical day, you might be administering a drug or inhalation sedation to a patient, and you've got to know that patient's medical history. You've got to know what you're putting inside them. You've got to know how that's going to interact, with their body, with other medication they might be taking. So you've got to have an appreciation for that, to be able to practice safely. The middle picture are the X-rays of the patient I showed you on the previous slide, where she had, so this is the inside of the mouth, teeth completely worn out and decayed. And so planning to get the patient from there to there, it is a process of evaluation of essentially engineering, So you've got to plan the mechanics of how you're going to achieve that end result and to ensure it's stable, not only, not only for the short term, but for many, many years to come. And I thought this was quite nicely highlighted by an engineer who I attended a lecture, who delivered a lecture several years ago that I attended. Who said, dentists and engineers are very similar in that they drill holes, they fill cavities, and then they construct bridges. I couldn't put it better myself. So that's that is very true in terms of what we do on a daily basis. And then finally, for those of you who are creatively minded, dentistry really does get your creative juices flowing. In that, this is an example on the right of a patient who wanted their silver filling changing to white fillings, and that requires an appreciation for palettes of color, of depth, of material choice, and all those things which combine to make that end result as stunning as possible and as natural as possible, which is generally the trend in Britain. In America, it tends to be more sort of glare, sort of glaring in your face, A++, super bright, get your sunglasses on. But that's a skill in itself, trying to get a natural kind of end result. And then the third, real important reason for me is that dentistry, as much as being clinical, is as much about being a business as well. And what I mean by that, and perhaps is something where doctors perhaps don't always have an appreciation for. It's nothing wrong with that. It's just a system they work in. But money changes hands in dentistry. So patients are paying you the privilege of working in their mouth and doing treatments for them. And and for that we need to invest in equipment. Oftentimes, our investments, the initial investment setting the stage. That's my surgery on the left. I have all these gadgets I work with, digital impression taking, lots of IT, and so the cost of constructing surgery initially does run to tens of thousands of pounds. So you've got to have a system where you're charging patients, you're being ethical about it. At the same time, you're making a profit to stay alive and to sustain your business. And you also have the element of working with people. So you're not only managing business, but you're managing people. This is one of the teams I work with, a lovely team, and you've got to manage all the different personalities within that team, and to make everything work as a well-oiled machine. And that's such an important part of making your business and your life just that much easier. And what that all gives you is both financial independence, as I put there, and career independence. What I mean by that is, because there are these financial elements of dentistry, you can choose what hours you want to work. You can, choose what days you want to work. You can choose who you want to surround yourself with on a daily basis. And that's, so much more than I can say for many jobs that I can think of. That you are at liberty to be a master of your own destiny in many respects. So there are, of course, as with any career, some challenges to dentistry, and I would highlight these as four primary challenges. What first and foremost is the journey. I make no bones about it. It is an arduous journey. It is lots of hard work. There are lots of late nights. Lots of stressful periods, and I'd say probably the most stressful period was probably my years in dental school, which thankfully got through. There are some people that didn't. You might have noticed in my initial picture that I put up of my class photo. I think my starting year group was about 93. I think we dropped out to 87 by the end of the 5 years. So yeah, people don't make it. But yeah, that's part and parcel of it. But you get through it. You develop ways of coping. You have your peers for support, and you get through it. The vast majority do. There's a public perception. So dentists, sadly, you open up the headline of any tabloid newspaper, you'll see dentists, portrayed as sadists, who like to inflict pain, money grabbing, etc. But for every negative persona that's painted about dentists, on a daily basis, there's so many more patients who are appreciative of what you do and who are grateful, and who do amazing things for you. Like just today, I had an hour ago, I replaced a patient's front teeth, which were missing for several years. And she literally cried. She was in tears by the end of it, and that was really touching. And patients inevitably, that happens. That's happened a few times in my career, and they inevitably apologise at the end of it. And I always find that quite strange, that it always goes back to that journey that you've been along, you've been with them on their journey, and that is sort of the culmination of the journey. So I always find that quite special. There's a health aspect of it. So some dentists suffer from chronic conditions related to the occupational hazards that we face. So things such as chronic back problems, or sort of high frequency hearing loss because of the high speed drill that we use on a frequent basis. But these are all things that can be prevented, by good habits that developed from an early age. And thankfully, these things aren't problems so much for dentists who are qualifying more recently, because these things are sort of taught in dentistry and how to prevent them and stop them becoming chronic problems. And then finally, there's the issue of regulation and litigation. Now, we often sort of find that our regulator tends to be one of the most heavy-handed among the other regulators within the UK. We certainly pay a lot for the privilege of them regulating us. I think of all the other healthcare professions, you probably pay the most in terms of our annual sort of retention fee. But then alongside that, we're being battered on that side of on one side by our regulator, but then there's always the ever-present threat of litigation, again, which I think is one of the highest in the world in this country. But again, a lot of these things are, yes, they are part and parcel of your career, and there are things you can do to mitigate that risk. One big part of which is communication, how you speak to your patients, how you relay to them, the proposed treatment and the plan, and risks, and things like that. So these things I mentioned, yes, they are challenges, and I've put them in there to give you a realistic impression of what dentistry is all about. But it should be a part of one's consideration. But I'd say the aspects of dentistry which really have attracted me, which I've highlighted in the presentation before the slide, far outweigh these things which are there in the background, but things just to be aware of. So I therefore conclude my presentation, and I hope I've been able to show you or give you a little snapshot into my world and to what makes dentistry so special. And I end with this slide to tell you that dentistry, why would you be a doctor when you could also be an engineer and an artist in the form of a dentist? Thank you for listening and for your attention today.
Thank you, Saad. That was really good. Thank you very much. Okay, guys, so we have a few minutes, okay, 15 minutes or so. Fire away if you have any questions, if you want us to clarify anything, if you want to challenge anything, here's your opportunity. So either put them in the chat box if you're shy, or feel free to unmute yourself and just ask the question, okay? And yeah. I think, Annie, you said a couple of questions, didn't you?
Yeah, so I'm Annie, I'm one of the Medsuccess committee members. Saad, outside of medicine or dentistry, were there any other careers that you considered when you were kind of before the age of 18 and considering university? And what factors did you think about that drew you away from those careers and towards what you are both practicing at the moment?
Saad, do you want to go first?
It's quite an easy question for me, actually, because I was always quite committed to dentistry. So I had a very single track mind, and I appreciate that's not the case for everybody, but I just really wanted to do dentistry from the age of 13. I appreciate that's quite unique. Many of my colleagues were in the same frame of mind. They sort of did toy with medicine, and I think that's understandable from the perspective of similar grades required, similar subject study, etc. But for me, it was always dentistry, to be honest. So I didn't really toy with anything else.
Yeah, I'm similar. I mean, I remember being very young and deciding that I wanted to be a doctor. I don't know what my drivers for that decision were at the time, but certainly I remember when I got to a stage where I could understand and make a choice and a decision, then medicine for me was a foregone conclusion. I think the only thing that I considered is if I don't get into medicine, I had a list of professions that I didn't want to do, okay? And I won't mention them because I don't want to insult any other profession. So I had a list of professions that I didn't want to do, and that was based on some experience that I had undertaken, some reading, speaking to people. I think realistically, had I not done medicine, what would I have done? I did have a backup plan that if I don't get in, so for me it was always I want to be a doctor, but if I don't get in for whatever reason, because I didn't get the grades, I didn't get an offer or whatever else, then I thought I'd probably take a year out and probably go down the maths or the economics type route, because I was also quite interested in that. But yeah, to answer your question, I mean, for me, it was a fairly simple, straightforward decision, which isn't always a good thing. People say, oh, he's committed to medicine, but actually, going through the process and considering different careers, having that experience, challenging yourself, asking yourself that question, actually sometimes is a better process to go through. But I didn't go through that. There's a question which I can happy to take. How would you structure the answer for why medicine and not something else, such as nurse, research scientist? I think the point that I was trying to make in my slides is I think we need to get away from these comparisons, okay? These are a problem. I think the way to answer this question is you have to be honest and true with yourself. Why do you want to be a doctor, not a nurse? What are the actual reasons? So are the reasons because a doctor has more status and prestige? Okay, well, that's not going to go down well in an interview. Is it because a doctor gets paid better? Again, that's not really going to go down well in an interview, because that's not going to serve you. What are your actual reasons? And so, to how do you structure your answer? And what I say to everybody, it's anybody can read any content online and just regurgitate it, but it's very obvious that when it's come from you, or when it's just been, read and memorized. And so the way I would tell you to answer that question is I would tell you to go back to your fundamentals and try and understand, why do you want to be a doctor and why do you not want to be a research scientist or a nurse? What are your actual reasons? How you present it is a different thing. But first you need to ask yourself that question. I think so to answer your question more specifically, how would you structure it? Once you've worked out what those reasons are, I think what's really important in the interviews, you don't put down any other profession, okay? You don't put down a nurse, a research scientist, or even a dentist, as tempting as it may be. But you do not put down any other profession, because that interviewer, their wife, their brother, their sister, their husband, their son, their daughter, whoever, might actually be a nurse or a dentist. And, you've actually said something quite negative about that profession, and that might put people off. So you never put anybody down in the interview. The way you address it is you demonstrate your respect for that profession, but then you demonstrate why you want to be a doctor more or a dentist more, okay? So that's how it comes down to. So the way I would say it is nurses do an amazing job. They work very closely with patients. They provide them all their intermittent care needs. But actually, what doctors provide that nurses don't is that combination of patient care with a higher level understanding of science. And then you can go into the details, whatever it may be. So, acknowledge, talk about why medicine is better. I hope that kind of answers your question. There is a feedback form with a link in the chat box. Please do fill that form in. That will be really, really helpful. We have a few minutes left. So if there are any other questions, please ask now. This is your opportunity.
So I'd also add to what you said, just an element of practical experience. So that's a very important aspect of it as well. I think certainly dental schools, probably medical schools as well, ask that you have had at least 2 weeks of work experience before applying. And I think that is something that's really useful to sort of relate to the interview process, that you perhaps have had some experience, although limited, of alternative careers.
Yeah. So yeah, I think I agree. I think you need to demonstrate that these ideas that you've got about this particular profession aren't just, something that you've woken up one day, or ideas that you've read in a book. How have you demonstrated and confirmed to yourself that you do want to be a doctor or a dentist or an optician or whatever you want to be? Okay. The only thing I would say to you is that getting work experience right now in the current pandemic, but also generally for, in pre-pandemic for medicine, is very difficult, and all the universities across the country will not penalize you if you haven't got medical specific work experience, but it's still necessary to get some sort of work experience in a care environment. Okay, whether that's a, a care home, whether that's something like, serving the blind, like Vista, for example, something that demonstrates that you actually have a caring, compassionate side. Okay, but if you cannot get primary or secondary care medical work experience, please don't stress about it. It will not be used against you in the interview, and that is very clear from all universities. Okay, any other questions? Otherwise, I was going to be an early bath. I've got a night shift tonight, so I can go and get ready. Okay, looks like we have no other questions. So thank you guys for tuning in today. Thank you once again, Saad, for pitching up and trying to convince us why dentistry is so amazing. You didn't convince me, but hopefully, the others would have found it to be of benefit.
But yeah,
special thanks to Saad. Thanks, guys. So the next, there's a question in the box. Just a thank you. Thank you to you too, Panit. So the next session and the last one is actually next week. And so next week, I believe it's on personal statements. There were many requests for a second interview session, because I think I did one for you guys about a month ago, and many of you tuned in, and quite a few of you asked me if I could do a part 2. Unfortunately, as things stand, I cannot commit the time to that. However, what we are setting up, and this will go live in the next few days, so keep an eye out, is online interviews. So it'll be first come, first serve. We'll have very limited numbers, and we will be providing online interviews for you guys. So keep an eye out for that. They will be free. There'll be no charge associated with it, like the rest of our webinar series. And we hope to run more than one session. So if you don't make it to the first or the second one, try not to despair, and hopefully you can get into the next one. So the first one is planned very soon, and you will hopefully hear about this. So keep an eye on our social media channels and on our website, and let others know as well. So Saad, do you have any closing statements, questions, or anything else that you want to mention before I close?
Nothing more, just only to thank you, and just to remind everyone to keep reflecting, and it's a journey ultimately in terms of deciding what you want to do as a future career. Keep reflecting, keep asking for advice, and keep in touch with ourselves. I hope to guide you along the way.
Great. Thanks, Saad. Thanks everybody else. Have a good evening. See you.
Okay.